Okay guys, so good day. Hope you're doing fine. This is the second part of our oncological nursing. This is meant for your afternoon session. Okay, so this one, we have last time we discussed about the clinical manifestations, the definition, the prevalence. Okay, and we also differentiate between the malignant and benign types of tumor. Now, we're going to kick off by going to the diagnostic test as discussed earlier. There are assessment and diagnostic methods in determining tumors or cellular aberration. It has these four, as stated last time: the marker identification, genetic profiling, imaging studies, and biopsy. Would be discussing that. Okay, as nurses that are right hand of the doctor or assistants to the doctors, or for example, you would become doctors yourself someday. Okay, this is a thing, especially in oncological studies, for you to grasp on or at least have an idea about. Okay, let's move on to the next slide. Okay, so I have here the slide. I've already had notes here in advance to save time. Okay, let me just add some notes. Okay, so we have here the tumor staging system. So it involves both assessment for benign and malignant tumor. It's more of describing the extent, location, and area of invasion the cancer cells or the abnormal cells are. Okay, so first of all, we have the tumor staging or the TNM. TNM is here in the right side. Okay, so TNM stands for yung extent of primary tumor, or T for the tumor, N is for your lymph node, and M is for your metastasis or spread. Okay, so staging determines the size of the tumor. For your T, existence of local invasion, the local nodes meaning, and then the distant metastasis or the extent of those cells where they are going or spreading. Okay, this is usually used for tumor staging. Okay, so take note, this tumor staging is for both benign and malignant. And then we have here, I've already placed it here. So what part of assessment? Usually that you would be assessing your lymph nodes, it's by the use of your palpation. Sir, what if the tumor is beyond palpation? Kung mga internal na siya, inside the intestine or colon, do we still have to do that? Yes, usually you have to assess that area or part, and then later on it would be backed up by a diagnosis or laboratory test or biopsy if ever operation or surgery is needed. Okay, let's move on to the assessment diagnostic methods. We have the stages. Okay, stages of tumor. Let me just go here by passing. Okay, so stage 1, easy level or yung chill level, yung first stage natin. Okay, so what are the, let me just simplify these words. The tumor is less than 2 cm. So maliit lang siya. And then wala siyang lymph node affectation sa mga karatig area. In the near areas, there are no enlargement of your lymph nodes. I'll just put negative lymph node. And then there's no metastasis. I'll just put METs for short. Okay. So for stage 1, what is it again? Less than 2 cm. Maliit lang siya. It's negative lymph node. There's no swelling or inflammation of your nearby lymph nodes. And there's no detectable metastasis. Natural kasi there's no lymph node involvement nga. Okay, for stage 2, second level or second stage, the tumor is greater than 2 cm. Sorry for this one. 2 cm, but it's less than 5. Okay? There may be negative or positive lymph node. So you could either palpate or you could either see or not see inflammation of lymph nodes in stage 2. But luckily, there is no metastasis, no mets. Hindi pa siya kumakalat. So, makikita mo lang inflamed kasi medyo malaki na rin yung tumor, yung nearby lymph nodes, but no metastasis. Okay, again, the size, 2, greater than 2 but less than 5. Okay, so 4.9 cm. Pasok pa siya sa banga. Less than 5 kasi siya, di ba? So, it may have positive or negative enlargement of your lymph nodes, involvement, and then no metastasis. Stage 3. When we say stage 3, this is usually greater than, sorry, my bad. Stage 3, it's greater than 5 cm. Positive na siya sa lymph node. Tapos, dito naman din, still negative metastasis. Again, what's the difference of stage 1, stage 2, and stage 3? So this is for mastery purposes. Stage 1, it's less than 2, negative lymph nodes, negative mets. For stage 2, greater than 2 but less than 5. There may be positive or negative lymph nodes but no metastasis. For stage 3, it's greater than 5. There's positive lymph node involvement or invasion. Or in this case, it says on the skin chest, okay? And clavicular area. Pag kinapa mo dito, yan, enlarged yung lymph nodes dito sa area ng ating clavicular area. Pero, negative mets. Okay, when we say stage 4, this is not stage 4 cancer class, ha? Let me remind you again, it's just stages of tumor. We're not saying stages of cancer pa. Okay? It's just the stages of tumor. Okay, so stage 4, sa size, any size. Sir, seryoso, kahit 1 cm lang yun, hindi ba namin makaklasify yun na stage 1? Okay, so let me finish off with this lecture first. Okay, let me just turn off my picture so that there would be spaces for the notes. Okay, size would be any size. There may be positive or negative lymph nodes. And you have positive mets. Okay. So, pag nakita nyo na yung positive metastasis, regardless of the size, regardless of the presence or absence of your lymph node activity or involvement, automatically, it falls under the category of stage 4. So, that's easier to understand, di ba? So, any size, there's involvement or non-involvement of your lymph nodes, basta positive metastasis, automatically, it's stage 4. Okay. So, that eases or sums up this slide. Okay. So, further assessment of the TNM. Okay. So, when kanina we talked about stage, this is more of your classifications or what you could see when we say, you could see this in your chart, TX, T0, TIS, okay, T1, T2, T3, T4. Okay, so let's just first focus on the primary tumor or your tumor. Okay, so when we say TX, tumor is not present. That's why parang TX, wala. Walang tumor dun sa area na yon. It cannot be assessed. Okay. T0. Sir, what's the difference of T0 with TX? Okay. There is changes seen, parang may laboratory test for tumor, but there's still no evidence. You can prove it for primary tumor. Okay. TIS, there is carcinoma involved already. So, TIS. And then, when we say T1, T2, T3, T4, it is the size. It includes already the size, the local extent of the primary tumor. Okay, later on, we'll be classifying the T1, T2, T3, T4. This is just the characteristics, okay, or system. Again, TX, there's no indicatory for cancer or tumor in the patient, okay, both in laboratory and diagnostics. T0 or TO, if you wanted to call it, there is no evidence of primary tumor despite there is basis seen in your laboratory or diagnostics. TIS, there's positive. It can be seen already in diagnostics or laboratory, the TIS, carcinoma. And T1, T2, T3, and T4, there's already tumor that has the indicative size, extent of that primary tumor. Okay, so when we say nodes, or letter N, excuse me, sorry for that, it NX means regional lymph nodes cannot be assessed. So when you assess the lymph nodes, they're really not present. Okay. So this one is unassessed, unable, cannot be assessed. This is the keyword. Okay. So when we say N0, there is changes in the lymph nodes, but parang inflamed lang siya, pero it's not pronounced or affected talaga din. Okay, so there is no affectation in the regional lymph node. For example, you're more on the laryngeal, you're checking laryngeal CA or tumor in the larynx or that localized area. When you palpate for the lymph nodes, you could see that there are lymph nodes that are inflamed, but it's not affected, na hindi talaga siya super inflamed na malalaki. And then N1, N2, N3, there is affectation in lymph nodes, usually swollen na yan, mainit na siya, and then there are other signs and symptoms. Okay, so ang pinakamadali sa lahat is yung metastasis. MX, walang metastasis with the laboratories and diagnostics. M0, there is probable metastasis but it does not spread. And later on, M1, yan, nag-spread na siya. Kumalat siya dun sa, hindi na siya dun sa localized area. It spread out in the nearby areas. So it's much more easier. Okay. Okay, so let me just be clear on that one. Sige. So, sir, pero medyo magulo. Let me just clarify. Okay? So, MX, there is no metastasis talaga. It's just localized in that specific area. No distant metastasis. Okay? You have your cancer or your metastasis. It's just on your, for example, it's just gastric. It's just localized in your gastric area. It does not spread in your intestine or your or your other parts, your lungs or the nearby organs. And then when you say distant metastasis, it involves other organs or system. Sorry for that. Okay, so that's clear. Okay, so here's the stages. Classification 10 stages. Okay. Yung grading nila by characteristics. Okay, so for stage 0, for your TNM classification, there's carcinoma in the system. Tumor is in system. There is no nodule and there's no metastasis. Sir, saan kinuha yan? Balik tayo dito. Ito. TX, T0, TIS, T1, T2, T3, T4, regional lymph, ayan, and then yung MX. Let's go back. For stage 1, for classifications and grading system, or staging system. Okay, for stage 1 of the cancer, the tumor invades the mucosa and submucosa. Therefore, you have tumor, T1, you have no involvement of your lymph nodes and no metastasis. Okay. Buray natin. Sir naman, ginugurihan nyo, hindi tuloy namin makita. Sorry naman. Okay. Wala, yun yung mabura. Okay, so yan na lang. Let me just use a pointer. Okay, here we go. Okay, so for stage 1, we have here the tumor with size 1. You have your lymph node 0 and metastasis 0. And what if the stage 1 is involving, it invades your muscularis or your muscular area. You have your nodule involvement number 2, or it may have no nodule involvement, okay? But your metastasis is 0. What if it's stage 2, okay? You have tumor 3 or T3 and 0, metastasis 0, okay? The tumor perforates or directly invades the adjacent structure. Tumor number 4, nodule involvement would be none. Metastasis is 0. Okay, katulad nung sinabi ko rin kanina, or any size or any tumor size, you have your nodule, what do you call this? Affectations. It's either nodule 1 or 1 to 3. Metastasis 0. Nodule 2, 2 or more nodes. Yan. And nodule 3, there are any nodule involvement along the vascular trunk. So when we say the vascular trunk, di ba? It's your system or truncal area. Di ba? Dito sa chest area natin, pag may mga inflamed lymph nodes sa area na yan, more than 4 or yung inflammation in that area, that means there's nodular involvement there. That's stage 3. Okay? This is just a in-depth chart of what we have discussed earlier. And for stage 4, sa size ng tumor, it would be any nodule it may or may not have, or any of the nodule. And matic, if there is metastasis, automatic, di ba? Stage 4 na siya. This is just an in-depth chart of what we have discussed earlier. Okay, so for tumor grading, sir, nakakatuwa naman yan. May characteristics na siya. It has its characteristics, it has its stages. May grading pa, di ba? So, yan lang. This is the grading, how we grade the tumor. Okay. So, this one classifies the tumor cells. It seeks to define the types of tissues from which the tumor originated. Okay. So, more on why do we have to check for this one? We have to trace the origins. Okay, so where it originated, to notify the degree, of function, and to have histological characteristics. Okay. So, bakit siya grade ng ganito? Again, it seeks to define the types of tissue from which the tumor originated, the degree of which the tumor cells retain the functional histological characteristics of tissue of origin for differentiation. Okay. It uses the numeric value ranging from 1 to 4. Again, T1 to T4. Parang, this is just the defined version for it. Okay. So T1, let me just remove this. T1 would be your well-differentiated. Madali siya ma-identify. And then T4 would be poorly differentiated. Dito nakadepend yung grade ng tumor. Okay. Let's go on. Oops. This is just the grading for tumor kanina, in-depth version. Okay, so what are the goals for treatment? Okay. Ang goal mo lang if you're going to treat tumor is first complete eradication. So pag sinabi natin complete eradication, we have the doctor and the nurse's goal by medical or surgical management would be removing the malignant disease or malignant tumor or cell. So when the doctor would say cure cure for cancer. Okay, let me just be frank with this one. When we say cure, there's still no cure for cancer. Let me just talk straight for this. This one means cure, meaning is the absence of the malignant cells or the malignant tumor inside the body of the patient. That's why when we say the patient is cancer free, upon test and diagnostics, there is no malignant cells or tumor seen in the patient. So that's the term they use for cure. Okay, so let's be frank with that. Hindi pa talaga siya totally na-eradicate kasi pwede pa siya bumalik, but the doctors and the nurses or the medical staff could declare the patient cancer free or cure from malignant disease. Okay, next one. The second goal is prolonged survival for the patient. Okay. And, sorry. And containment of the cancer cells. Okay, when we say prolonged survival, hindi yan yung para sa cancer cell. This is for your patient. Mag-survive yung patient mo and makontain nila, localize the cancer cells. Okay, when we say localize, the growth rate would be decreased or would be on standstill. So when we say it's already controlled, the cancer is already controlled, there is containment of the cancer and there's no growth or decreased growth. Okay, and last but not the least, it would be relieved from the symptoms associated with the disease. Okay. Sige, so relieved from the symptoms, syempre the patient would have anemia, weakness, and other yung caution as and yung AWWP if you still remember that. Okay, yung anemia, weakness, weight loss, and pain. Yan. That are the symptoms that would be relieved with the use of palliation. Okay, let me emphasize in that again. What's the goal and treatment for management of cancer or tumor, malignant cell? First is complete eradication. Ano yung eradicate? Yung malignant cells para matawag natin na cure. And then what's your second goal? It's the prolonged survival for your patient. Okay? And also containment of the cancer cell. It's localized. It will not grow or multiply. And it would be under control. Okay? So for your control. And then last but not the least is to relieve for your symptoms. It's more of palliation. Okay? So, yan. Cure, control, and palliation. That's your main three goals for treatment. Sige, gawa natin ang acronym. Goals for treatment, CCP. What what is CCP? Cure, control, and palliation. Yan yung mga ating shortcut. Okay. So, what are for medical treatment or management, those are the goals. So, what are the therapies used for your surgical management? Okay, so usually, in your surgical management, they would be removing the tumor. Ito yung mga OR cases nyo, yung tinatanggal yung mga cyst, tumor, at saka binabiopsy at the same time, okay? So, removal or extraction of tumor on whatever location or part of the body. That's your surgery. And then, number 1, this one would be, sige, lagay na natin surgical and medical management. Okay? So, second one is your radiation therapy, also known as your chemotherapy. It may be used individually or combination. So, I won't be focusing more about this kasi this would be discussed in your pharmacology. But usually, chemotherapy, the goal for it is for your cure. It eradicates the malignant cells. But as radiation therapy and chemotherapy goes, syempre, it would affect also your good cells. Therefore, it has also side effects or signs and symptoms that will be later discussed. down the line of our management. Next one would be another surgical procedure. It would be your bone marrow transplantation. Sir, bakit may involvement na ng bone marrow dyan? Remember, di ba, your bone marrow is or helps generates yung blood vessels natin. Okay, so it also aids in the growth and it is the storage for maturation of new blood vessels, sorry, blood cells, okay, not blood vessels, blood cells. So bone marrow transplantation helps in um, specific types of cancer, especially in blood-related types of cancer. So, since, di ba, doon nagge-generate and nagmamature yung inyong mga blood cells, and since, di ba, yun, it generates yung, what do you call this, deformed or abnormal cells already due to the genetic modification due to cancer. So, therefore, a new bone marrow transplantation would be advised. Okay. And then we have our other target therapies. For example, your biologic response modifiers, gene therapy, complementary and alternative medicine. Okay, so yan, biologic response modifiers, gene therapy. Hindi gene na, hindi yung GIN na gene. Gene, GENE. Okay, so therapy and complementary and alternative medicine. Okay, so there are other therapies used. Okay, next. Okay, so here for the surgery, I said earlier as well, so let me just correct this slide. Surgical or medical management. Okay, so the goal of the surgery is to remove the tumor, yun nga din, as much as it is feasible. So, kumbaga nag-grow na siya habang localized pa siya. Tanggalin mo na yung bad or yung localized tumor so that it won't spread to other system. That's why that's one of the goals of the surgery. Okay, so, di ba, may CCP na din tayo. Cure, palliation, and control. Pwede natin din idagdag yung removal. Yan yung goal natin. So again, yung removal, it's more of the surgical. It's to remove para hindi na siya maka-apekto dun sa iba. So parang yan yung ano, di ba? Sasabihin sa inyo na, uy, hiwalay nyo nga yung bulok na kamatis dun sa magagandang kamatis. Bakit mo siya gagawin early? Or why do you have to segregate the rotten tomatoes from the good tomatoes? Kasi there is a tendency that that rotten tomato would affect your good tomatoes. That's why as early as possible, you remove the rotten tomato so it won't be affecting the nearby good tomatoes. Basically, that's the good, parang that's the goal of the surgery. Okay, so types of surgery. Okay, maybe in a primary method of treatment. Okay, so this one is early. And you have your prophylactic. For example, it's already metastasized and it damaged already your this is prophylactic. When we say prophylactic, ahead of time or in advance. Okay, so there is detected growth of tumor in certain types of cell. In advance, you have to do that surgery so that parang prevention is better than cure. You're suspecting it already, then you have to remove that part already or that organ already. Palliative, this is in the late stage. When they say palliative, it's causing the pain, and it would be beneficiary for the patient if that tumor or organ is removed. Therefore, doing palliative surgery. When we say reconstructive, it's more of bypassing that area. For example, there is colonic CA. The large intestine is large. What they do is they reconstruct the large intestine. They would do bypass of certain parts of the colon. Okay, so that the removed part or the affected part would be avoided. Okay, So that's one of your reconstructive. Parang mag-aano sila. Gagawa, they would, if you're going to put it in real world setting, it's like there is a road here. There is a damaged road here. For example, the road here got what do you call this, washed out by the sea. Okay, so will you be doing another road over this one? This is already damaged. So what you're going to do is you're going to do a bypass road. You do a reconstruction of the road so that the function would be still functions would be still retained despite of the damaged area. Okay, so for example, there's a road. Originally, your road was here. They would do a reconstruction of the road so that life goes on and the function of the system would be saved. Okay, so that's what reconstructive mean. Okay, so here maintaining. Okay, so for nursing management, take note: future nurses or future doctors who are planning to go to med school afterwards. You're a nurse in creed training, so remember that nurses are caring. Once you become doctors, don't forget that you were a nurse once. Okay, so the care is very much different. So remember where you came from. Okay, so what's the nursing management? Okay, so for the nursing management, you need to maintain skin tissue integrity. So it means that you would avoid further skin breakdown. For these samples, you have stomatitis. There is already inflammation of the skin around the stoma or opening. So as nurses, you have to avoid or prevent the patient in having this kind of conditions. Okay, so sometimes skin integrity, the skin reacts also due to radiation therapy. Okay, this is also a part okay, so diba we talked about chemotherapy earlier. When you say chemotherapy, it's or radiation therapy, it's toxic to cells, not only to the bad cells, but it's also toxic to the good cells. So when you say radioactive or radiotherapy, it kills also your good cells. The target is your bad cells, but good cells die along the way. Good cells die along the way. Therefore, your skin protection, your skin is made up of cells. Therefore, your skin would be having irritations or reactions due to radiation therapy. Your hair is also made up of cells. Yung base or yung glands of your hair will be affected with the radiation therapy. Therefore, having your patients to have alopecia or fall out of hair or baldness. Usually, di ba, makikita niyo yan it's always portrayed in movies or dramas. Patients having radiation therapy or cancer or undergoing chemotherapy always has alopecia. Okay, so as much as possible, we have to maintain tissue integrity. Okay, and malignant skin lesions, you have to watch out for that. Okay, so what are the nursing interventions that you have to do? Assess the oral cavities daily. Okay, watch out for bleeding. Make sure that they are intact. Report for oral burning pain or areas or redness and oral lesions. Okay, lesions is parang wounds or opening or break in skin. And if there are pain in swallowing, kasi sometimes the throat is also affected. Next one, provide oral hygiene. Okay, so same is true with dengue. Okay, not that aggressive brushing. Use brush with soft bristles. Okay, use non-abrasive toothpaste after meals. Okay, so and at bedtimes. Here, it also says that avoid tobacco and alcoholic beverage and commercial mouthwash. Why? Diba? So, sir, bakit naman? Bakit bawal tobacco and alcoholic beverages and commercial mouthwash? So, okay, tobacco has irritant substances in the mouth. Therefore, irritants, since patients is having impaired tissue integrity, it might cause oral lesions in prolonged use. That's why We ask our patients to avoid tobacco, alcoholic beverages. Diba, ang alcohol, in any type of percentage, have a sting in it. Yung medyo masakit or mahapdi pag ginagamit. Or sometimes, as part na rin with the chemotherapy, your mouth is not that acquainted, the patient with cancer's mouth is not that acquainted with strong beverages as well. So it has a reaction in the gums, therefore the gums being irritated would be swelling, and it could lead to lesions or irritation in the oral area. Same is true with mouthwashes, kasi some mouthwashes are built really strong for mouth cleansing. That's why you have to instruct your patient to have safe oral hygiene. Okay? Next one. Okay, so here we have stomatitis or singaw. What are the nursing interventions? Use NSS for mouth rinses. Okay, if ever the patient is having dentures, after meals, ask them to remove it. Kasi if your patient slept with the dentures, sometimes the dentures would fall off or misfit while sleeping. Then the patient would either bite or accidentally injure himself or herself with the dentures. That's why make sure to remove the dentures and clean it after. And then make sure that they fit to avoid slips and accidental punctures in your mouth or the patient's mouth. Use water-soluble lip lubricants. Avoid foods that are spicy, hard to chew, and within extreme of temperature. That's preserving your oral cavity. That's for your mild stomatitis. And for your severe stomatitis or yung mga singaw na sobra-sobra, obtain tissue sample for CS, assess gag reflex, ability to chew and swallow, provide liquid or puree diet. This one is assisting your nutritional intake, and monitor for dehydration. Kasi yun nga, it's severe stomatitis. Pag umiinom or kumakain, masakit or nasasaktan or naagrabyado. That's why you have to monitor the hydration status and assist in nutrition intake for severe stomatitis. Next one. We talked about chemotherapy in passing. Managing radiation-associated impairments. Okay, so provide careful skincare. So avoiding use of soap, cosmetics, perfumes, powders, lotions, ointments, and deodorants. Usually for people who have undergone radiation-associated skin impairment, chemicals react to chemicals. Just remember that. Okay, so when the patient has undergone radiation therapy, let's ask the patient to avoid using soap, cosmetics, perfumes, powders, and ointments or deodorants that may react to the radiation therapy. Sir, so ibig sabihin yan, hindi na maliligo yung patient namin. Kasi hindi na magde-deodorant, so babaho yung patient namin. Okay, so pwede naman maligo. Number 2, use only lukewarm water to bathe. Pero right after therapy, or if you're seeing skin impairments due to radiation, you could ask your patient to cleanse up with lukewarm water. Take note, lukewarm water. Sir, kumukulo pa yan? Hindi, maligam-gam lang yan na tubig. For foreigners, lukewarm is not that hot and not that cold. So it's in the middle temp of both worlds. Okay, so that's what you call lukewarm. Okay, next one. Avoid applying hot water bottles, heating pads, and ice adhesive tapes to the area. Why? Okay, so usually, radiation-associated skin impairments, usually the patient has decreased, especially for patients having after chemotherapy, yung sensitivity ng patients nyo is impaired due to the therapy and their body is reacting because of the medications or therapy that were given to them or chemotherapy. So avoid muna yung applying hot water. Hot water, sometimes the patient would not parang diabetic patients, they would not feel well or they could not sense well if the hot bottle or pads would be applied to them. So it would cause either further burns or injury to the skin. Okay, so take note, the sensory or perception of the patients right after chemotherapy would be impaired. That's why you avoid extreme temperatures. Okay, so makikita nyo dito, you have hot and extreme cold. Sir, cold, ice. So, hindi nila nararamdaman yan. Adhesive tapes to the area since skin is irritated. And sometimes, tape when forgotten in the patient's skin, when you remove it. So, minsan, we cared for patients who have undergone let me just turn on my camera. We cared for patients who have undergone chemotherapy. They have really sensitive skin. That's why we use hypoallergenic tape, or sometimes we don't use adhesive tapes at all. Kasi once you pull the adhesive tapes, sumasama talaga yung balat. The skin would peel off with your tape. That's why we do not encourage to use adhesive tapes for the patients. Okay, another thing. Sir, what if sir, paano naman yun? They undergone chemotherapy. Paano po yung mga pinagtusukan ng laboratories? Paano po yung mga injection sites or yung IV sites? How would they manage that one? Okay, so they use hypoallergenic tapes if really needed, or sometimes dun sa mga punctured sites na tinanggal rin yung needle, without the needle, they would use compression lang. They would ask the patient or the relatives of the patient to press on and use compression to that area, therefore avoiding the use of tape. And last but not the least, do not shave the area kasi hypersensitive yung skin ng patient. Using of sharp objects would cause either skin impairments further to the patient. So remember, patients that has undergone radiation therapy or chemotherapy has high risk of skin impairment. Okay, take note of that. Next slide would be, sorry. Okay. This one is also part of the skincare. These one are mostly self-explanatory. First is avoid rubbing or scratching the area. Same is true. Exposure to sunlight or cold, that's with our temperature, our hot and cold weather. I've explained the rationale earlier. Okay, so I'll avoid wearing tight clothing over affected area. So what does tight clothing do to the affected area? First of all, tight clothing has compression. Okay, so sir, ano naman meron sa compression? So compression has pressure on it. Pressure on that area. Sir, sabi nyo kanina, pressure is good for that area. I was saying earlier that pressure is only good for a certain amount of time, especially if site is bleeding. And but compression, you're wearing it, so hindi mo naman siya tinatanggal agad, di ba? Alam namang you just wore your tight clothing. The patient would wear that tight clothing and then later on you would ask him to remove it. So, avoid pressure on that area, on the affected area, kasi it might cause skin breakdown or damage. Okay, next one. If ever your patient develops blisters, okay, so blisters are, di ba, for example, here is the skin of the patient, hand. Okay, so this is the IV site, yung pinagtusukan ng chemotherapy or ng radiation therapy. If ever the patient would develop blisters, this is parang elevation or bevels in the skin, usually contained with water. It has shiny skin there. Do not disrupt it. You might be tempted to poke it and burst it, but do not. And instead of poking it, document it. If you could check or note the size, it would be much better. You must report it and use the prescribed ointments to avoid skin opening and breakdown. Okay. Next one. Let me remove my face again so that you could focus on the slides. Okay, so here we are addressing alopecia. So we've talked about earlier, alopecia is the loss of hair. Okay. So another thing, unique thing with us nurses is when you know the intervention, you develop also your health teaching. Okay, so when chemotherapy is applied to the patient or radiation therapy is being given to the patient, instruct your patient or have health teaching that when you go or undergo chemotherapy, there is a potential of hair loss. But don't worry, the patient might be worrying, oh, my hair will be lost. How can I manage that? Or, nurse, will my hair return back to normal? The answer is yes, regrowth is possible. after the treatment naman. So, while the treatment is ongoing, expect the patient to have hair loss. Okay, next one, explore the potential and impact of hair loss on self-image in interpersonal relationship. For example, um, let's say your patient is a really um, influential person. He or she relies on his or her look. Okay, so you explore the potential of impact on his or her self-image or perception of self and interpersonal relationship. Help him or her plan. 'Di ba? Usually, ganyan naman yan. So, you help out and then you would see that he or her might be depressed. You're there to do therapeutic communication and there's a community or the family members must be involved with this one as well. Okay, so ways in coping hair loss. Okay, these are your health teachings or possible suggestions to your patients. So, you may purchase a wig or hairpiece before the hair loss. So, mamili na in advance para at least, okay, this hairstyle would suit you. If ever you're ongoing treatment, you wear a wig so that parang wala lang nangyari, okay? So, either wear a head covering, use a bonnet, use a hat, or whatever the preference of your patient or the cancer patient would be. Prevent or minimize hair loss. Okay, so this one is usually conditioning. For guys, it's much more easy. They shave their hair prior to the treatment so that people would get used to that look. Okay, next one would be avoid excessive shampooing and hair processing. Kasi prior to, usually chemicals would either irritate also your hair aside from the radiation therapy. So avoid excessive shampooing or hair processing. Avoid excessive combing or brushing. This one is forced in your hair kasi your patient might be brushing and combing his hair vigorously, therefore increasing the hair loss. Okay, instead na konti lang yung mawawala sa patient mo na hair, tas excessive naman yung brushing and combing niya, yun, naubos yung hair ng patient nyo. And lastly, explain the hair growth usually begins again once the therapy is completed. Okay, so that's more of the patient interaction and patient teaching. Let's move on to the next slide. Managing malignant skin lesions again. So carefully assess and cleanse the skin. Again, with no strong chemicals or cleansing agents. Assist and guide the patient and family regarding skin lesion care at home. Okay, this is important. Let me emphasize on this one. Usually, the patient's relatives, you must involve the patient's relatives when they go home. Kasi they might be reliant on you doing the skincare always. Later on in their part of your nursing care, you teach one significant other or a companion on how to do it so that they would gain confidence that before they go home, at least they're confident enough to help out with the skin lesion and skin care for the patient. And last but not the least, if ever there is no person responsible to take care of the patient, refer to a home health service if indicated or available in that area. Okay, this is more of the nursing management. So we're done already with the skin lesions and alopecia. Next one would be promoting nutrition. So again, AWWP, anemia, and weight loss. So for having anemia and weight loss, we must provide proper nutrition and proper sustenance of vitamins and minerals. First, okay, so avoid unpleasant sights, odors, and sound in environment during mealtime. Why is it? Kasi, um, kasi I spoke Tagalog. Because unpleasant sights, odors, and sounds in the environment during mealtime may cause the patient to go on nausea and vomiting. So, another side effect of radiation therapy, the patient could feel nauseous and could induce vomiting. So, di ba? Kumbaga, may chances na nga sila masuka or maging masama yung pakiramdam, dadagdagan mo pa ng unpleasant sound, sights, or door or sound during the meal time. So, to induce din yung appetite ng patient nyo, set a pleasant environment for meal consumption. Next is preferred and well tolerated by the patient. So usually, kung ano yung gusto ng patient, as long as it's high calorie, kasi you want to replace energy to the patient or give energy to the patient, and high protein food. High protein is since may weight loss, gusto mo mag-build ng muscle mass, so you encourage foods rich in calorie and protein. Okay, next one. Encourage adequate fluid intake. Yun nga, kasi malnutrition na yung patient mo. Ask the patient to have adequate fluid intake. When we say adequate, baka sabihin nyo, ay sir, kailangan nyo ubusin yan, yung fluid na yan, 8 to 10 glasses. Adequate means enough not to be dehydrated and not to be on fluid overload. Okay. So, what happens when you encourage large amount of fluid during mealtime? Okay? So, the tendency is your patient would get full already if you encourage a lot of fluids during mealtime. Mabubusog na yung patient nyo, mawawalan siya ng gana kumain. You need to replace calories and nutrients by eating food. Therefore, you limit your fluid intake during mealtime and then encourage fluid intake in between na lang ng meals. Okay? If ever the patient is having loss for appetite for big or large meals, okay? Use smaller and frequent feedings. For example, hindi niya kaya ng 3 times a day na marami yung breakfast, lunch, and dinner. They would be dividing those meals to smaller breakdown. For example, 6 times siya kakain in a day. Breakfast is half. There's in-between meal before breakfast and lunch or brunch. Lunchtime in half or 1/4. And then a snack. And then later on, the dinner. So, it's broken down. And at least, hindi rin nasasayang yung food for the patient. Okay. Another one is a relaxed, quiet environment during mealtime. Okay. With increased social interaction as desired. If ever na, syempre, it would be depressing for the patient to be alone while eating. But as much as possible, it would be pleasant enough to have a relaxed and quiet environment during mealtime. Okay. So, when we say social interaction, it means that there's at least someone with the person. At least ginaganahan siya kumain kasi, di ba, though despite the COVID-19 or the pandemic, it's good to eat with people, di ba? It boosts your, what do you call this, appetite. So, usually, a presence of a certain person would increase or at least as desired by the patient would increase or make the patient eat more. Okay? So, yan. Especially with us Filipinos, we're used to eating in large groups kasi mas nakakagana pa kumain. Okay, next. Nutritional supplements and high-protein foods in between meals. What I have said, we want to replace supplements, supplement losses to be absorbed by the body and protein foods between meals. Okay, so frequent oral hygienes with its precautions, yun nga yung what we have said earlier, and relieve of measures during mealtime. And then last, if ever the patient feels nauseous or vomiting, we control it. Okay. So for this one, avoid oily foods, dry snacks usually. Kasi usually oily foods induce parang nausea or in vomiting. So avoid oily foods. And if ever may mga ice chips and crackers, yan usually. Para sa food in case na nauseated or the patient has the urge to vomit. We could ask the patient to snack on those. Okay? Next one. Again, for promoting nutrition. Okay. Encourage verbalization of fears and concerns. When I was reading this slide, I was telling myself, why do I have to encourage the patient? What does it have to do with nutrition? Okay, so there's a rationale here. When the patient verbalizes his or her fears or concerns, the stress is lessened with the patient. So verbalization of concerns and fears is an outlet of stress. So when the patient is less stressed, especially after the chemotherapy or treatment, it would be promoting his GI tract to absorb food more. Okay? And this is a form of nagkakwento siya habang kumakain. Okay, so at least there's meal progression. So at the same time, it induces your absorption for nutrients. Okay. So and last but not the least, 'di ba? Advise the family and friends not to nag about eating. Huwag niyo pipilitin yung patient or yung tao na nag-undergo ng treatment. Kasi when you nag about patient, ikaw nga, uh, sinisermonan ka ng nanay mo habang kumakain ka. Magkakaroon ka ba ng gana kumain? O kaya sinasabi na lang na kumain ka nga kasi kailangan mo yan kasi, di ba nakakawalang gana yun kumain? So, advise the family and friends not to nag about eating. Huwag pilitin yung pasyente. Kasi kung hindi naman niya, gustuhin man ng pasyente niya, gustuhin man ng patient na kumain, pero hindi naman niya kaya, wala din, madidepress lang yung patient. Kasi kung tatry niya, tas masusuka lang din siya, papagalitan din siya. So, parang it's degrading to the patient. At least give the patient chance to eat and the chance to parang build his or herself up. Okay? So, it's more of psychological part, but it has to do with nutrition. So, for our collaborative management, okay, provide, if ever, nahirap talaga kumain yung patient, provide enteral tube feeding for commercial or liquid diets. Okay? So, when we say enteral feeding, dito na yung pumapasok yung ating NGT, yung patient, yun yung ilong ng patient. Meron tube na linalagay sa patient. That's called an NGT. Tapos, pag sinabi nating tube feeding, meron yan na bulb syringe. Tapos, dito nyo ilalagay yung feeding. If ever hindi makalunok yung patient. Para so that they could what they call this, absorb the nutrients, at least get some nutrients. So yung food yan didn't drip and it would go straight to the patient's stomach. Okay, so that's enteral tube feeding as ordered. So that's why it's called collaborative, because you need to have the doctor's order for it. Hindi yung as nurses you would be inserting an NGT and then feeding the patient. So you need collaborative management for that one. Okay, so the doctors would also prescribe how many kilocalories that is needed to the patient. In hand, we would be working with the dietitians. That's why you've undergone nutrition for nurses. Okay, so it might be commercial liquids or diets, elemental diets, blenderized food or OF as prescribed. Okay, so, administer appetite stimulants as prescribed by the physicians. These are your drugs that could have stimulants to increase your appetite. So, those are already also considered to have for collaborative management. Okay, let's go to the slide only. Okay, so for relieving pain, this one. First one is what again? First one is for skin integrity. Next one we have for nutrition. Nutrition. Third is for pain management. Okay, so with here, these are nursing management, but there's no nursing problem. So you have to generate the nursing problem by yourselves. Okay, so first, it's a multidisciplinary team approach. Okay, usually this is more of collaborative because your pain. Okay, so first of all, when we say pain, we have your non-pharmacological, which is the independent nursing, and you have your pharmacological, which is your collaborative. Okay, in this point of pain relief, you exhaust all your independent nursing. You have your relaxation, meditation, diversion. If you have exhausted this all, usually we go to the collaborative part. That's why it's called multidisciplinary team approach. there is a team to manage pain, and they would be the ones to give medications for that one for optimal management. Okay, so make sure to pay attention and acknowledge that the pain is real. You might be saying or you might be non-therapeutic to your patient na, oh, it's not that painful. Hindi naman yun masakit eh. Inarte ka lang naman din eh. Okay, so that's the Tagalog term for it. Sasabihin natin na, oh, hindi naman totoo na masakit yan. Nag-iinarte lang yung patient natin. Maarte lang yun talaga. So, not that one. You're being non-professional and non-therapeutic. So, um, for foreigners, that's saying that the patient is only more lingering or making up things. It's not that painful. Okay, it's just acting or being dramatic. It's being non-therapeutic and non-professional. So acknowledge that the pain is real, because first of all, you're not the one experiencing the pain, but the patient. Kasi he or she might have a low threshold for pain tolerance. So acknowledge that the pain is real. Next one is educate and support correct fear and misconceptions. Kasi sometimes pain is psychological. Dito yan pumapasok yung placebo. So, educate that, correct the fear na, for example, I might die, and then the patient gets psychosomatic disorders, or the patient suddenly feels pain due to psychological stress. So there comes the education to support and correct fears and misconception. Okay. So take note of the strategical plan or the pharmacological management. Okay. So here, do your non-pharmacological first. Try setting up the patient in a good environment, relaxed environment, not stimulating environment. Try divert the patient. Let him watch TV. Let him read a book, so that he would forget the pain. If that doesn't work, check the pharmacological management. What pain relievers work with him? What pain relievers did not work with him during the past pain experiences. So that's management of your pain via strategies. And if ever things would not work out, think of new strategies to relieve pain and discomfort. So it's here already: distraction, imagery, relaxation, continuous, and stimulation. Okay, so I encourage you guys to do the non-pharmacological nursing first. If it gets resolved for that, then good nursing care. But if it doesn't and it's really painful, there we go. We go to our collaborative nursing care. Okay, next one. Okay, so we're done with skin integrity. We're also done with nutrition and pain. We go to the decreased fatigue. This is for your AWWP. Okay, this is for your weakness. So the weakness in or decreased fatigue target. So we need to decrease the weakness for the patient. Okay, so make sure that the fatigue is temporary and expected with side effects for cancer process and treatment. Usually under treatment, after nila mag-treatment, feeling nila drain sila. Wala silang energy. So tell your patient that the fatigue is only temporary. Make him or her work out or work in a tolerated manner or in the pacing of the patient, for the patient not to be used to that sedentary lifestyle or that parang feeling of weakness. Okay, so usually it takes time and it takes a lot of effort and motivation. Next one is arrange, schedule, and organize activities to conserve energy. Alternate periods of rest and activity. For example, don't do workouts or long walks and then you don't have rest, and then you would be doing another strenuous activity. So at least structure and schedule and organize activities that there would be rest at least periods for your patient. Kumaga schedule parang walking and then rest, and then meal preparation and then rest ulit, and then eating, tapos a little bit of rest again and then walking. So it's not all strenuous for the patient. Okay, next one is relocate responsibilities. For example, the patient is used to caring for the child, cleaning, meal preparation. here goes the relocation of responsibilities. It's either hiring someone to do it for him or her, or for example, the household um, task or chores would be distributed so that the patient could rest after treatment. Okay, so this one also correlates with nutrition, protein and calorie intake, makes the patient energetic. Okay, and then assess for fluid and electrolyte disturbances because sometimes um, essential electrolytes are lost during radiological therapy. That's why we have to monitor fluid and electrolyte disturbance. Okay, so regular light exercise. Remember the words light exercise. Don't do hardcore cardio exercise. So regular light exercises so that the muscle tone won't shrink, and at the same time yung endurance and fatigue of the patient would be lessened. Okay, next one would be relaxation techniques and mental imagery. Aside from being a pain management, this one is a form of rest, therefore decreasing the weakness or fatigue for the patient. This one is conservation of energy as well. Address factors that may contribute to fatigue. Example, pain. Usually, di ba, pag in pain ka, um, energy is lost because of the pain. Usually, you are feeling weak, helpless when the pain is there. So, address the pain first so that fatigue would be later on ironed out. Administer blood products as prescribed by the physician for anemia or having imbalances with your RBC and other blood components. Blood administration or products must be given as prescribed. Okay. Okay, next one would be body, self-image, and self-esteem. Same as with the hair loss or alopecia. Okay. Assess the feeling about body image and level of self-esteem. Encourage verbalization of concerns. Identify potential threats to self-esteem. Altered appearance, decreased sexual functions, hair loss, decreased energy, and change in roles. Continued participation in activities and decision-making. Assist in self-care when fatigue, lethargy, nausea, vomiting, and other symptoms occur. So this is more of improving body image and self-perception. Okay, another thing with psychological and at least yung return to optimal level of functioning for the patient. Okay, assist in selecting and using clothing that accessories that increases sense of attractiveness. Simple words like, ma'am, that hat looks wonderful on you. You must wear that. Kasi, yun nga, it's more of self-appreciating and boosting the self-esteem of the patient. You're not, um, hindi ka nambobola sa pasyente. I don't have the English term for it. Okay, you're not scamming your patient. That's the closest word that I can think of. You're not scamming your patient to wear that hat just for the sake of you to make the patient to be dressed and ready for some activities, but rather you're asking the patient to wear that hat to boost his or her self-esteem. Okay, so refer for collaborating specialists as needed. Kung kailangan ng stylist or goods, may kakilalang marunong mag-style na at least ma-boost yung ng patient or nung person na nag-undergo ng radiation therapy. Okay, so that's the goal of it. Helping and making the patient feel good about his or herself. Next one, assist in grieving. Okay, so maybe I'll just be cutting here. We're done with some nursing management for the part 2. This would be our part 3. Thank you very much for listening. It's been almost an hour. I'll be chopping this one for 1 hour session so that you could be watching it at your own pace. Okay, so good day guys, and I hope that you have enjoyed this lesson. Stay tuned for the part 3 and we'll be continuing this part in assistance of grieving. Thank you and God bless. Bye-bye.